Have you heard about something called Medicare Part B excess charges, and you'd like to know what they're all about? Well, stick around because I'm going to explain what excess charges are and how they could affect you. Hi, I'm Shawneen Sullivan, founder of USA Medicare Plan, where we help people on Medicare find low-cost options for Medicare supplement and prescription drug coverage. Today I'm going to talk about Medicare Part B excess charges. Excess charges are an amount up to 15% that a doctor or provider can charge over and above the amount that Medicare approves for services. Excess charges come into play with Original Medicare Part B. Medicare Part B covers outpatient medical services such as doctor visits, lab work, tests, surgeries, durable medical equipment, ambulance services, and preventive services. If you have a Medicare supplement plan, then you also have Original Medicare Part A and Part B. With Medicare, there are providers that are participating and non-participating. They both agree to accept payments from Medicare for the services they provide to patients. Doctors and providers that are participating accept Medicare and also Medicare assignment. The term assignment means that they agree to accept Medicare's payment as payment in full. Medicare uses their approved physician fee schedule, which includes the maximum allowable amounts that providers who accept assignment will be paid for services. So if the provider accepts assignment, then they can't balance bill the patient for any extra charges. If a doctor or provider is non-participating, this means that they do accept Medicare payments, but not as payment in full. So if they choose to, they can, however, accept assignment on a case-by-case basis. For non-participating providers that don't accept assignment, Medicare placed a limiting charge of 15% for any excess charges over and above what Medicare approves. Non-participating provider payments are also reduced by 5% from what's on the Medicare fee schedule. So the patient will be responsible to pay the provider's remaining charges up to 15% more, unless they have a Medicare supplement plan that covers excess charges. Providers can also opt out of Medicare. This means that they won't be reimbursed by Medicare at all. The provider will have to get their full payment from the patient. Doctors that opt out of Medicare are required to notify the patient of costs before treating them, and the patient is responsible to pay the full amount of the bill. Before the 1990s, Medicare paid doctors and providers differently than they do today. At that time, not many doctors accepted Medicare assignment. Excess charges were common, so most people wanted to have a plan that covered those excess charges. Back then, most people that had a Medicare supplement plan chose Plan F. Medicare pays 80%, the Plan F picks up the remaining 20% that Medicare doesn't cover, including any excess charge billing. Excess charges are something we don't see happen very often. Most doctors today accept Medicare and Medicare assignment. Here's an example of how Part B excess charges work. Jane visits the doctor and the office visit charge is $115. Medicare's allowable charge is $100 and Medicare pays 80% or $80. Jane pays $20 plus $15 in excess charges, and this equals $35. If Jane has a Medicare supplement plan that covers excess charges, then she would have nothing out of pocket. The Medicare supplement will pick up the 20% that Medicare doesn't cover, and some plans cover the excess charges as well. Medicare Supplement Plan F and Plan G cover Part B excess charges 100%. The Medicare Supplement Plan N is becoming very popular with our clients, even though excess charges aren't covered in most states. It still makes a lot of sense for people to get this plan because of the low monthly premiums compared to Plan F and Plan G. With most doctors and providers today accepting Medicare assignment, this makes excess charges less of a concern. In some states, by law, excess charges aren't allowed. This law is called the Medicare Overcharge Measure, or MOM law. So if you live or travel to any of those states, you won't have excess charge billing in those states. One way to avoid excess charges is to make sure that your doctors are fully participating in Medicare before seeing them. You can find out if a doctor participates in Medicare by going to the Physician Finder tool on Medicare's website. I hope this video has helped you understand Part B excess charges and how they might affect you with your Medicare coverage. If you have any questions, please call or email us. Our service is 100% free and we're happy to help you. If you like this video, please give it a thumbs up and be sure to watch our other videos to help you better understand your Medicare.